I'm going to present a project that we want to have on chemo care unit. The cancer burden has showed a steady increase with an estimated 0.8 million new cases, cancer cases every year. The chemotherapy has definitely changed the course of disease from it being a terminal catastrophic one to being a treatable and many a times a curable illness. But the flip side to the chemotherapy is the toxicities related to it. And the impact of chemotherapy is on both the treatment as well as the quality of life. As far as treatment is concerned, it may lead to dose reduction, delay and termination of treatment, which can impact the outcome of the disease. And as far as quality of life is concerned, it may result in frequent emergency room visits, hospitalization, increased costs, which ultimately reduces the quality of life of patients. Monitoring for toxicities and intervening at the right time helps the patients to move forward in treatment plan, as the interruption in treatment plan have potentials to adversely affect the treatment goals. Department of Medical Oncology at Tata Memorial Hospital, the approximate yearly statistics is as follows. There are about 450,000 OPD turnarounds for chemotherapy. There are about 250,000 daycare visits in a year, and about 82,000 of them are casualty visits for the toxicities related to chemotherapy. And we envision that supportive care by the chemo care unit personnel will help in having symptomatic benefit to about 80% of our patients. Of them, 80% of the sick patients would benefit from either getting into serious adverse events or succumbing to this adverse events because of chemotherapy. The review of literature has shown with regard to toxicities related to chemotherapy. A study done by Heber et al. On intracycle unplanned hospital admission because of the cisplatin. It was the 316 patients were enrolled into the study, and it was seen that 24% of the patients have intercycle unplanned hospital admissions, and major proportion, that is 23%, was because of the chemotherapy related toxicities. A study done by Alison Pierce et al. On incidence and severity of self-reported chemotherapy side effects, in which the 449 eligible individuals were enrolled who had a median follow-up of about 505.64 months, and it was seen that at least 86% of the participants reported at least one side effect because of the chemotherapy during the study period. 27% reported grade 4 toxicity, and the common problems that were reported by the participants were fatigue, dyspnea, followed by diarrhea and constipation. A study done by Isabelle Ingrand et al. In French province in the year 2012. This was a retrospective analysis of the records of the patients, and there were more than 1,000 patients whose records were analyzed, and it was seen that the incidence rate of serious adverse events because of the chemotherapy was nearly 44.5%. The literature with regard to the nurse-led telephonic follow-up in patients who have received chemotherapy, there are quite a few studies. A study done by Craig Hunter et al. On evaluating the impact of telephonic nurse care management during high toxicity chemotherapy was analyzed. And here the patients were actually counseled by the nurses with regard to the side effects of chemotherapy, pain management, on how to seek care if at all they develop any toxicities. And it was seen that there was a decreased among the experimental group on the 14 days follow-up. There were the IP admissions, the inpatient admissions were reduced by 44% as compared to the control group. In a study done by Tracy Ruegg et al. On nurse-delivered telephonic interventions in reducing oral mucositis and preventing dehydration in patients receiving chemotherapy and radiation therapy for the lung and head and neck cancers, the study was run in two phases. In phase one, the nurses actually delivered the intervention during the entire course of the treatment, and in the phase two, they actually asked the opinions of the paid participants with regard to the telephonic follow-up management. And it was shown that actually it reduced the incidence of mucositis as well as dehydration. And additionally, it also benefited the patients in having a faster recovery. They received the answers quickly, had lower incidence of depression, and they were actually helped both physically as well as emotionally. So it is seen that nurse-led supportive telephonic interventions are a simple and a very effective way to evaluate a patient's adherence and provide strategies to patients' self-management of their care. So for this, we have used a orange self-care model, wherein the patients are actually there is a self-care demand because of the chemotherapy and related toxicities like CINV or even mucositis, dehydration, diarrhea, constipations, etc. And they need to take care of themselves in order to tide over these toxicities and also follow the entire course of treatment, which will ultimately improve the prognosis of the disease. But they are not able to do it because of the various reasons, and that's where the nurses will come into the picture, where they will be providing the knowledge about the chemotherapy and its toxicities, and also the telephonic assessment with regard to toxicities and the advice based on the grade of toxicity. The plan of the project is as follows. We've already inducted some of the nurses. We're training them in class and out of the class in OPDs, injection rooms, and also the emergency rooms. The nurses will be posted in three shifts, that is morning, evening, and night shift, and they will be given one set per shift, a handset, telephone, and the patients after receiving chemotherapy for the solid tumors, uh, adult solid tumors, will be given a telephone number of the nurse who will be in working in those shifts, and the patients will be asked to call them up whenever they have any difficulties with regard to their health. The patients, when they have problems, they will call up the nursing staff, and the nurses will assess the grade of the toxicity based on the CTCAE 5 guidelines. If the patients have any grade 1 or 2 toxicity on assessment, the patient will be given the telephonic advice, like maybe with regard to diet or maybe with regard to the medications, because we see many times the patients have been given the medications to control nausea, but they don't take it and they end up with grade 3 and 4 nausea, vomiting. If the patients have grade 3 or 4 toxicity, the patients will be advised to come to the casualty or the emergency room. This assessment and subsequent advice will be given by the nurses in consultation with the on-call medical oncologist. The expected outcome after the implementation of this
Ma'am, please
chemotherapy.
summarize.
Yes, the management of toxicities may reduce in inpatient and outpatient outpatients, thereby having the financial savings to patients, employees, and the third-party insurance. Can reduce the treatment delay, can prevent dose reduction, and may impose a sense of well-being and improve health-related quality of life. This is a budget that we have for 1 year, that is 30,000 salary for a nurse for a month, and for a year it will be for 10 nurses 36 lakhs, mobile phones 20,000, and mobile bills would be about 4 to 5,000. Thus, the total budget of 36 lakhs 24,000. Thank you very much for your patient listening.